Post-traumatic stress disorder, or PTSD, is a mental health condition that can have a profound impact on an individual's life. It's triggered by a terrifying event, often one that is unexpected and overwhelming. This event could be something you experienced firsthand or something you witnessed happening to someone else. PTSD can cause significant distress, affecting your emotional and psychological well-being. It can interfere with daily life, making it hard to function at work, maintain relationships, or even perform simple tasks. PTSD is not a sign of weakness. It's a natural response to an unnatural situation. It's a natural response to trauma, a way our bodies and minds try to cope with extreme stress. Our brains are wired for survival, designed to protect us from harm. When we experience danger, our bodies go into fight, flight, or freeze mode, preparing us to respond to the threat. This is a natural and healthy response, essential for our survival. But sometimes after the danger has passed, our brains can get stuck in this survival mode, unable to return to a state of calm. This can lead to PTSD. PTSD can affect anyone. It doesn't discriminate based on age, gender, or background. It doesn't matter your age, gender, or background. Trauma doesn't discriminate, and neither does PTSD. Trauma doesn't discriminate, and neither does PTSD. It can affect anyone, anywhere. Understanding PTSD is the first step towards healing and recovery. By recognizing the signs and seeking help, individuals can begin their journey towards a healthier, more fulfilling life. PTSD casts a long shadow. It affects how you feel, think, and act. It can disrupt your sleep, relationships, and work. The impact of PTSD is far-reaching. It touches every aspect of a person's life. Imagine living with a constant knot of anxiety in your stomach. You might feel on edge all the time. You might have trouble sleeping or concentrating. You might feel emotionally numb or detached from others. You might avoid places, people, or activities that remind you of the trauma. PTSD can also manifest in physical symptoms. You might experience headaches, stomach aches, or muscle tension. You might be easily startled or have an exaggerated response to loud noises. PTSD is a complex condition. It's important to remember that you're not alone. Diagnosing PTSD is a step-by-step process. It's not a one-size-fits-all approach. It involves a comprehensive evaluation by a mental health professional. This could be a psychiatrist, psychologist, or clinical social worker. The first step is a thorough medical history review. This helps rule out any underlying medical conditions. The next step is a psychological evaluation. This involves talking about your symptoms, experiences, and medical history. The professional will ask you questions about your thoughts, feelings, and behaviors. They will also assess your level of distress and impairment. The goal is to gather enough information to make an accurate diagnosis. Remember, honesty is crucial during this process. The more open you are, the better equipped your mental health professional will be to help you. To diagnose PTSD, mental health professionals use specific criteria. These criteria are outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. The DSM-5 is the standard reference for mental health professionals. The criteria for PTSD are divided into 4 main categories: intrusion, avoidance, negative alterations in cognition and mood, and alterations in arousal and reactivity. Intrusion symptoms include flashbacks, nightmares, and intrusive thoughts. Avoidance symptoms involve staying away from people, places, or things that remind you of the trauma. Negative alterations in cognition and mood can manifest as negative thoughts, feelings of guilt or shame, and loss of interest in activities. Finally, alterations in arousal and reactivity can include being easily startled, having difficulty sleeping, and being on edge. Section 5. Screenings and Tests, Unveiling PTSD. In this section, we will explore the various methods used to diagnose post-traumatic stress disorder, commonly known as PTSD. There are several screenings and tests used to diagnose PTSD. These screenings are essential as they help identify the presence and severity of PTSD symptoms. These tools help professionals assess the severity of your symptoms. They provide a structured way to understand what you're experiencing and how it impacts your daily life. They also help track your progress over time. Regular assessments can show how your symptoms change, which is crucial for adjusting treatment plans. One commonly used screening tool is the PTSD checklist for DSM-5 or PCL-5. This checklist is a self-report measure that asks you to rate how much you've been bothered by specific symptoms in the past month. This self-report measure asks you to rate how much you've been bothered by specific symptoms in the past month. It covers a range of symptoms including re-experiencing, avoidance, and hyperarousal. Another screening tool is the Primary Care PTSD Screen for DSM-5 or PC-PTSD-5. This tool is often used in primary care settings to quickly identify patients who may have PTSD. This shorter screening is often used in primary care settings. It consists of just a few questions and can be a quick way to flag potential PTSD cases for further evaluation. In addition to screenings, professionals may use psychological tests to assess for PTSD. These tests provide a more comprehensive view of your mental health. These tests provide a more in-depth understanding of your symptoms, personality, and cognitive functioning. They can help identify other mental health issues that may be present. Some examples include the Minnesota Multiphasic Personality Inventory, or MMPI, which is a comprehensive test that assesses a wide range of psychological conditions, and the Clinician-Administered PTSD Scale for DSM-5, or CAPS-5. This is a structured interview that provides a detailed assessment of PTSD symptoms and their impact on your life. Section 6. Self-assessment tools gauging your symptoms. While self-diagnosis is never a substitute for professional evaluation, there are self-assessment tools available online. These tools can help you gauge whether your symptoms might be consistent with PTSD. Keep in mind that these tools are not diagnostic. They are simply a starting point for understanding your symptoms. One reputable online resource is the PTSD self-test, provided by the Anxiety and Depression Association of America. Another option is the PTSD screening quiz offered by the U.S. Department of Veterans Affairs. These tests can give you a better understanding of PTSD and its symptoms. However, they are not a replacement for professional help. Section 7. Subtypes of PTSD, variations on a theme. PTSD is not a one-size-fits-all diagnosis. It manifests differently in different people, influenced by a variety of factors including the nature of the trauma, the individual's personal history, and their support system. There are different subtypes of PTSD, each with its own unique set of symptoms and challenges. These subtypes help clinicians better understand and treat the condition. One subtype is complex PTSD or CPTSD. This type of PTSD often develops in response to prolonged or repeated trauma, such as childhood abuse or neglect. Unlike standard PTSD, which can result from a single traumatic event, CPTSD is the result of sustained trauma over months or years. This can deeply affect an individual's emotional and psychological well-being. People with CPTSD may experience additional symptoms, such as difficulty regulating their emotions, problems with relationships, and a distorted sense of self. They might also struggle with feelings of worthlessness and persistent sadness. Another subtype is delayed onset PTSD. As the name suggests, symptoms of this subtype may not appear until months or even years after the traumatic event. This delayed reaction can be particularly confusing and distressing for individuals, as they may not immediately connect their symptoms to the past trauma. This can make it challenging to connect the symptoms back to the trauma. The delay in symptom onset can complicate diagnosis and treatment, often requiring a more nuanced approach. Understanding the different subtypes of PTSD is crucial for tailoring treatment plans to meet individual needs. By recognizing the specific challenges and symptoms associated with each subtype, mental health professionals can provide more effective and personalized care. Section 8. Navigating life after diagnosis. Your roadmap to recovery. Receiving a PTSD diagnosis can be overwhelming. You might feel a mix of emotions, including relief, fear, and uncertainty. The most important thing to remember is that you are not alone. There are resources available to help you navigate this journey. The first step is to find a therapist specializing in trauma-informed care. They will work with you to develop a personalized treatment plan. Treatment for PTSD typically involves therapy, medication, or a combination of both. Therapy can help you process the trauma, develop coping mechanisms, and manage your symptoms. Medications such as antidepressants or anti-anxiety medications can help alleviate some of the symptoms, such as depression, anxiety, and sleep disturbances. Section 9. Seeking support, your lifeline to healing. Recovery from PTSD is possible, but it's not a journey you have to take alone. Seeking support from loved ones, support groups, and mental health professionals is crucial for healing. Talk to your loved ones. Let them know what you're going through and how they can support you. Consider joining a support group. Connecting with others who understand what you're going through can be incredibly validating and empowering. Remember, asking for help is a sign of strength, not weakness. It takes courage to confront your trauma and seek support. With the right support and treatment, you can heal from PTSD and reclaim your life.